So yesterday, my wife and I went to the fertility clinic to discuss our possible treatment options as far as getting my wife pregnant. On April 8th, this was about 2 weeks ago, I had taken my last semen analysis, and I hadn't had one for months. And I hadn't had the results back from this yet. And basically what we were waiting to find out to some extent was whether the surgery for varicocele that I'd had, July-August of last year, had had any effect. And the short story is no, it's had no effect at all. The quality of the sperm is very poor. They're not sure that there's anything there present or viable. And so basically the surgery, was a waste of time. The options now I'm left with are these. We can go forward with in vitro fertilization. There's a process called ICSI where basically they find one viable sperm cell and inject it directly into the ovum using microsurgery. Very advanced technology. The process, as some of you out there are aware, is a very invasive one for my wife. She has to undergo about a month of injections. It really messes with her body's chemistry. Basically, they force her to ovulate a whole series of ovum and then extract them and then implant them with these sperm cells. However, because there are so few sperm, it may be that they would have to do a direct extraction from me, for which, as I understand it, it's basically a biopsy, taking sperm directly out of the testicle. And he is suggesting that because there's so little sperm that I'll probably have to have a donor backup anyway. And this is a sperm donor. I'm left with a rather difficult situation because if I just say, you know what, it doesn't matter that the child is mine, we just go through using a sperm donor. We don't have to go through the IVF procedure at all. There's a much cheaper, much simpler solution available, and it's called intrauterine insemination. It's much more straightforward. It's much easier on my wife, Hope. It's much cheaper, and I just forgo a genetic future for myself. I really don't want any platitudes from you about, I'm sure that you'll be a good father to a child that isn't yours, and it doesn't really matter as long as it's well taken care of. I really don't want to hear that. Maybe if you're not a guy, you don't understand this. I think that's a distinct possibility, but a lot of anger and violence and nastiness throughout the generations have been as a result of men feeling that they're raising the children of others. So please do not discount the kind of emotional content that this decision involves. This is not easy for me because part of the problem is I can go to the urologist. I have another appointment with the urologist who will make the ultimate determination of what is feasible in terms of whether my sperm is viable at all. The difficulty is that I just have a distinct distrust for many physicians, particularly surgical specialists, because they have extreme confidence in their own procedures and will go to extraordinary lengths long after pragmatism would have set aside the treatment and said, enough, no more, you're not going to produce any viable sperm, look for a viable solution. They won't stop. They will never say die. They will just keep going, And I've seen this in end-of-life cancer decisions with specialists, and I've seen this among, lots of physicians. And they're admirable for their tenacity, but on the other hand, if there is no viable possibility that on the day that my wife is undergoing the procedure to extract these ovum that I'm going to produce viable sperm, there are much easier solutions available to us. But then again, I still have to come to the opinion that I don't care that we're going with a sperm donor. And I think ultimately I can make peace with that solution. I can make peace with that, and of course, as I've said before, any child that comes into this home will be welcome. But I have to say that giving up having a child of my own is not easy. I'm going to take this moment of emotion, if you want to put it that way, to be extremely blunt with some of you. For those of you who are saying, I don't know, should I get the treatment? I'm kind of embarrassed to talk to my doctor. It's not something I'm really comfortable. You know what? Suck it up. Go to your doctor if you think you have varicocele, or you have something wrong with your balls, you think you have something wrong with your testicles, you think you have something wrong with any part of you. Suck up the embarrassment and go talk to your physician. If I had sought treatment earlier, I might not be having this conversation with you. So I understand sometimes, life makes this kind of thing awkward. Too bloody bad. Get treatment if it's available. For those of you who wonder about the cost of varicocele, again, I sympathize with the fact that sometimes you're never sure that you're being handed a treatment that you actually need, and that's just a matter of finding somebody you trust. And I know that's difficult, but putting a cost on never being able to have children is, I think, something you should reconsider. If you can pull together the funds, do it, because having to face this, having to face the possibility that had I done something at some earlier stage, I could have kids, you just suck up your embarrassment and go get help. Really. Beyond that, we'll have to see what happens. As I say, I have an appointment with the urologist probably in a couple of weeks, and we'll see what he has to say about the feasibility of mine being able to produce anything for this procedure. As you may have guessed, I don't feel good right now. I'll get over it. We always get over things. But this is very, very difficult. And I think there is the difficulty that we are handed these options for incredible treatments, and I understand the excitement of physicians in that they're able to offer possibilities that 10 years ago, 15 years ago would have been completely out of reach. And yet, I don't know that they know when to say stop. And that puts you in an awkward position. And it means that I have to make these decisions, have a child of mine or not, that I don't wish these decisions on anybody. That's it. Thanks very much.